Good day, everybody. I would like to introduce you to the topic for today, which is about THC and cannabidiol, and comparing them and contrasting these major phytocannabinoids and how they work within the body and how you can use that to your advantage and understand the differences between the two. Our agenda is going to include a general overview, the endocannabinoid system. We'll talk about the entourage effect, and I'll go into some detailed information about the actions of these two very important molecules and compare and contrast them for a better understanding. First off, the endocannabinoid system, which is really at the heart of our body's system as the master regulator of these three major systems, the neurologic, immunologic, and endocrine system. We usually think of the cannabinoids working on the neurologic and the neurotransmitters, and certainly all of the nerve functions that are going on, particularly at the synapses. But also there is a great deal of regulation that's going on within the brain and surrounding the nerve cells themselves, because they are very much the support tissue that's around them is very important to the health and the well-being of the nerve and the brain tissue, particularly the glial cells, as well as the cells that produce and provide the blood-brain barrier. Immunologically, we look at the endocannabinoid system as involving the immune cells and the immune tissue, widely distributed in the body, and migrating to those areas where there is inflammation, infection, or some area of trauma. We don't usually think of it in the role of an endocrine controller, but the fact is our sleep, our digestion, our hunger, our passions are all regulated and modulated by the endocannabinoid system. And so it's very important to understand all these things are going on. And for the longest time, we haven't had any direct approach or that we could use or direct to the endocannabinoid system. But within the last 15 years, we're actually seeing compounds and chemicals and pharmaceutical drugs that can work on these particular systems and modulate them hopefully for the better. Unfortunately, all of the artificial products of pharmacologic products that have been created have numerous adverse effects that are associated with them, and several have actually been withdrawn and taken off the market. So at the core of what we're talking about in terms of these major phytocannabinoids, we're looking at this system and modulating at least a portion of this system and trying to maintain it. You know, when the endocannabinoid system gets out of balance, we're faced with a number of disease possibilities. At least there's a correlation and an association with a number of major problems like fibromyalgia, things like irritable bowel syndrome and migraine. They're not really defined well in terms of pathologic mechanisms. We still don't understand what's going on exactly. However, we do and we can see significant changes in the endocannabinoid system with a variation of either receptors or with the endocannabinoids themselves. And so the use of phytocannabinoids may be a solution to intervene and help restore the system to balance. It's not a matter of pushing it one way or the other way. It's a matter of bringing it into balance and regulating this entire system. Along the same lines, when we're talking about making any regulations and adjustments with the phytocannabinoids, we've got to be mindful that the cannabinoids work better as a group, not as an individual agent. Every time the pharmaceutical industry tries to pull out one effect and use a silver bullet to take care of one problem, they end up with several other complications and problems. Mother Nature does not like to be fooled. And so the entourage effect is very, very important in making all of these things work together. Within the phytocannabinoids, particularly within cannabis, what we're looking at are a collection of different substances that all have a major role, and they all can provide particular value in what is going on health-wise in helping to recover from a number of conditions. So in looking at the substances that are involved, we're just going to be looking at THC today and CBD, but we're actually overlooking a host of other substances that are contained within cannabinoids and cannabis, particularly the cannabinoids even. There are more than 60 different types of cannabinoids that have been identified in cannabis extracts. And so there's a huge host of these. Now, we usually think that they have to be at certain concentrations to be effective. In fact, combined effect may give the equivalent of having higher or lower amounts of THC or CBD just by the combined cannabinoids and some of the benefits that they offer. And it's very clear that they offer significant benefits when they're isolated and they've been given, and we see some different changes. But combined, I think we're seeing the best results from that. In addition, they're terpenes. One of the factors that probably makes a big difference in terms of the extracts and the different species of cannabis actually are the terpenes. These terpenes are lipid-like molecules, simple structures, about 22 carbons, but they have the ability to signal the body in a number of different ways. A lot of the substances that we see as essential oils are in fact terpenes. Even the CBD and THC are a form of terpene in terms of that overall classification. In addition to the terpenes, and there are dozens as well, in addition to the terpenes, there are also flavonoids. We don't think much about the flavonoids with respect to cannabis, but in fact, these are the substances like are in red wine and in different special juices that provide an influence on how these molecules, the CBD or the THC, how they're working on the body. And we do know that they have particular influence in how we feel, as well as the inflammatory effects that they offer. In addition to the flavonoids, there are also polyphenols. And these are difficult to describe, except that in the general category, they are anti-inflammatories. They provide a huge number of benefits. And these are the substances that are coming from natural and whole foods that we take in our diet, but they're also coming in through cannabis. The fact is that all of these things combined enhance the effect of the cannabinoid active molecules in THC and CBD much, much greater than if they're isolated. Looking at THC, I want to focus on the upsides, actions of THC, the benefits that we're typically seeing from, and you can see from THC. We see that as a partial agonist. Essentially, it is making a connection with the cannabinoid, the endocannabinoid receptors, type 1 and type 2, but it's not a firm, absolute bond. It is a partial agonist, meaning that it makes connections, it has effects on it, but it's not gripping the receptor with a intensity that can't be released. And so it's modifiable, it can change, and it's not absolutely fixed on those receptors. There are also some other receptors that THC is involved with, but not of any major degree. The benefits and what you see with THC is there's a euphoria and a psychoactive effect that can occur. Some people enjoy that. Some people that is very disconcerting. There's also the pain relief, the relaxation, and the reduced inflammation that's associated with THC. And remarkably, THC helps to reduce the opioid withdrawal and other medications as well, as a result of its modulation of the opioid receptors throughout the nervous system. A particular advantage in helping to get away from the dangerous opioid drugs that we're encountering. Now, unfortunately, THC has a number of downside effects that can be problematic and that have been in a number of cases. Some of these are real, very real, and some of them are theoretical. They haven't been confirmed absolutely, and we're not confident completely in the literature in that there may have been bias in the data that was collected on this. But these, in general, are the pieces of information that I've gathered to, and I find in the evidence in the medical literature. Psychosis. One of the problems with THC is that it can induce psychosis, and there are a number of cases where individuals have gone into a psychotic state, difficult to get them out of it, and it's precipitated even schizophrenia. There's also levels of impairment. I know this is widely debated, but it's pretty clear that it produces motor impairment and there's cognitive impairment, and sleep induction can occur. So it's very, it can be very significant and certainly a great problem for a number of people who are trying to maintain themselves in a functional state while relieving some of their other symptoms. Probably the most important one that I want to focus on is the downregulation of the endocannabinoid system. And the reason this is important is that, and you see this in the effect of THC in being a tolerance developing, in that many people are able to take larger and larger amounts of THC before they actually feel the effects. What's happening there is there's actually this downregulation where the number of receptors is decreasing and the number of cannabinoids are decreasing. And so it may be that as a result of chronic THC use, we're actually incapacitating our endocannabinoid system and leaving us vulnerable to some other conditions. Certainly there's an appetite increase that is associated with THC. Now that can be a good thing or a bad thing. Most of the people today with 70% obesity look at appetite increase as a problem. But certainly for people who are suffering from different cancer and the side effects, stimulating their appetite is a great thing for helping the recovery. Now, there's a neurodevelopment issue that has been brought up in some of the science showing that exposure of young people prior to the age of about 22 has been associated with neurodevelopment changes, shifting of their brain function in one way or another that tends to be lasting, and it's not just incidental. And perhaps these things can be overcome. Some of the early studies, in particularly the Jamaica study, showed that at 5 and 6 years old, the kids who had been born with parents who were using THC did not appear to have any issues. In fact, they were better developed socially than the other children. But if there were regular use of THC in teenagers, it's hard to say what exactly that's going to cause or produce, and there have been some detrimental findings in that. There's also a limited range of receptor actions for the THC. We certainly know about the cannabinoid type 1 and type 2, and there is interaction with the anti-inflammatory effects, but mainly they're working through the CB1 and CB2 type of receptor systems, not much on the other side. So now I want to go into a look at CBD. So cannabidiol on the upside, it modulates the cannabinoid type 1 and type 2 receptors, but the peculiar thing about cannabidiol with regard to this receptor is it's quite variable in its interaction, and it somewhat depends on its concentration. On the diagram at the right, you can see that CBD is listed as an inverse agonist, and so that's kind of like a blocking the cannabinoid type 1 receptor. So you've got a blocking effect, and with an increasing concentration, you get even more and more effects at blocking the CB1 receptor. Now, the reason that could be important is because the CB1 receptor has been associated with a number of inflammatory conditions. and by CBD's action to downregulate and diminish that particular action, it could be providing specific benefits. In fact, we know it is. The endocannabinoid system, G protein receptors, there's about half a dozen at the present time. CBD is interacting with all of these receptors. Now, sometimes it blocks them and sometimes it works as an agonist. But it suffices to say that there's a considerable interaction that's going on with these receptors, and they are regulating a number of other processes, both within other systems like the neurologic, immunologic, and hormonal system, as well as cellular function. There's direct membrane action of CBD that works on the cell membrane as well as the organelles inside, including the nucleus. So you're getting specific action that is going on, just like the mitochondria, where it's working on the membrane to allow for the permeation of certain minerals and salts, as well as for signaling the mitochondria to shift its metabolism, perhaps away from the complex 1 type of oxidation process that's going on. It upregulates it upregulates the endocannabinoid system. It brings up the number and the level of endocannabinoid receptors, as well as the number of endocannabinoids and the metabolites that are involved with it. So you have a boosting of this entire system that modulates our homeostasis. It modulates THC effects, and so that whereas you may encounter a psychoactive effect from THC, the CBD seems to reduce that effect, and a number of other memory issues as well in combinations with THC. All in all, I've counted at least 94 mechanisms of action that cannabidiol is associated with, working on different parts of the body, different systems, different cellular systems, and different organ systems. So what are the CBD downside actions? Well, I haven't really found any of those at this time. Still looking, and I hope to add to that. And as a result, I really don't have anything terrifically negative except to say that CBD does not always work, and that there may be a need for THC along the way. So here's a list of my 94 mechanisms. Most recently, a G protein receptor 3 and 6 were identified that are involved with Alzheimer's disease. A lot of these things are just newly coming out. There's an explosion in the literature looking for mechanisms that are involved in these cellular processes, with the idea of the endocannabinoid system being involved. The best thing for almost all conditions is a combination of THC and CBD. What that combination is, what the ratio should be. Usually we're talking, or there's some discussions about having a 1-to-4 ratio or a 1-to-18 ratio. That is not well defined, and I'm not sure that we're going to be able to get to that location anytime soon. But I presented this wheel that shows the combined effects where this author has particularly put some emphasis on combining CBD and THC and some of the other cannabinoids that might be involved in aiding and helping a clinical situation. Absolutely true. I think that THC in many cases in some cases, needs to be involved with CBD. But in my clinical practice, I've not seen that to be a common entity, a common situation. In fact, what I'm generally seeing is the benefit of CBD is on the order of about 95% of conditions can be addressed with the CBD, and with the only requirement of perhaps 5% or less requiring THC addition if I don't get the results that I'm looking for with the CBD. Now, if you want to compare and contrast these two substances, there was an interesting study that gave this comparison, a tale of two cannabinoids by Dr. Russo, and he gave the listing of literature that shows these two particular substances and what studies. Unfortunately, this is not currently accurate. There's a lot of discrepancies that are present in it with more recent literature that's come through. Looking at the particular actions, when you compare THC and CBD, we're seeing this ECS modulation. Certainly, it's a little bit like yin and yang, where we're seeing specific effects for THC in doing one thing, and we're seeing the counter effects of CBD, so that they're offsetting one another and providing a balanced situation for regulation. And then depending on the body situation, the disease, or the organ systems, then you're getting a balancing effect. The range of actions for THC and CBD is quite different. We're seeing a fairly narrow range for THC, but a much wider range that's involved with CBD. Individual mechanisms, I've already pointed out 94 of them that we've identified with cannabidiol, with more of a less than a handful with respect to THC. One of the areas of particular point that I've been looking at is fear memory. THC does not appear to extinguish and to prevent the reconsolidation in fear memory associated with PTSD. And so I see CBD as being the major thrust here that helps people to get better and possibly make that a lasting improvement. Recent studies have shown an extended period of recovery from PTSD-like symptoms as a result of using CBD alone. In epilepsy, THC has value, but the predominant chemical that is most effective here is cannabidiol. With regard to behavioral conditions, with the danger of psychosis and that you could come off, that could be produced, as well as the lack of specific effects, then cannabidiol is once again very strong in this particular area, working on, and it's been proven to be effective in schizophrenia, depression, anxiety, and as well as a number of other particular problems. And finally, with respect to opioid withdrawal, both cannabidiol and CBD are effective in helping with opioid withdrawal. In fact, the mechanism that's in place for this condition, or these problems, is actually works on the benzodiazepines, nicotine, and some of the other substances. And so that cannabidiol and possibly THC could be used in this particular area. The problem with opioid withdrawal and other substances, people are not and are interested in adding another potentially addictive substance like THC that might be included that. So CBD has a role here that would be accepted within the public, as well as having major benefits for taking care of many of the other symptoms as well. And those typical symptoms that we see from cannabidiol come along with the pain relief, the mood elevating properties that are there, the anxiety reduction, and the enhanced memory and processing that CBD offers to people in the cognitive realm. In addition, there's that anti-inflammatory effect and an immune balance. As an anti-inflammatory, what we know that CBD is more effective than vitamin C and vitamin E in that regard. So, and then we've got the regulatory effects on the immune cells specifically. And on top of that, another side benefit is that improved sleep that goes along with using cannabidiol. So if we're looking at basic dosing, I recommend that we start off, or you start off, with using cannabidiol as the main ingredient and the main approach with a whole plant product, so that you've got that entourage effect. There is a small amount, insignificant amount, but a small amount of THC that are in the elixinol products that can provide that entourage effect and the benefits of being combined. Whenever I use any of the elixinol products, I like to start with a standard dose, about 15 milligrams twice a day, and then adjust upwards according to their particular need. So let me recap some of what we've gone over. The THC and CBD offer major health benefits for everybody. So on so many different conditions, we're still exploring and learning about what those are. The whole plant provides the entourage, and the benefits of the entourage enhancing the effectiveness of the cannabinoids in a number of different ways. That's why I don't think that they're going to be able to develop pharmaceutical products that are going to be pure, or isolates that are going to be pure and are going to offer the benefits that come from whole plants. CBD is sufficient in 95% of the cases, and so I encourage you to start on that side, and with the possibility that if you don't get, or the patient is not getting the effects that they want and need, then the addition of some THC may be of some value. Use CBD start and then supplement with THC. So it's been good talking to you. I've put together some of the references on THC and CBD at this particular website, and you can go into that folder, and I put a number of documents for your review, including these slides, so that you can reference them and take a look at even my notes about what I took about my research into this particular area. At this point, I'd like to open it up for questions and try to get all of your questions answered and take care of that. I get this question: will CBD show up in urine tests for employment? Well, there's no significant amount of THC that's in CBD, and a little bit of that depends on the testing type that's done for THC in the urine. There's certainly different levels of testing. The most stringent level is 20 nanograms, and I think that's the lowest that I've seen. And that's a pretty close detection, and that would detect THC exposure, not CBD, but THC exposure within the last 3 weeks for sure, and up to 4 weeks if you had any exposure during that particular time. On the other hand, the National Hockey League does test for THC, but their levels are at 250 nanograms. So a substantial difference. And the other area that the other threshold that's commonly used is 50 nanograms. That becomes a difficult situation. It's not likely that somebody is going to come up THC positive on any drug screens, but even with a small amount, we have heard stories about people coming up positive, although I've never seen a documented case nor been in a situation to absolutely ensure that the patient wasn't exposed to some other products that might have contained much larger amounts of THC. In the general climate and in terms of the products that are available on the market are highly variable and unreliable because there's no real regulation going on. I know at Elixinol that is measured, each batch is laboratory tested to find out exactly what's in it, the concentrations, and if that's something you want to know about, then that information is available for you to check. You know, I'm particularly excited about the role that CBD could play in the opioid epidemic. And I want to pass this on to you. I want to talk a little bit more about it because it's so exciting. Because I have patients who are using for pain and are using opioids, or they're suffering through not having any opioids. When they're on opioids of all different varieties, I'm seeing a major reduction of the need for opioids, as much as 80%. And they still have the same levels of benefit. When that happens, I ask the patients just to space out their doses of medications, and so they're getting reasonable coverage. I don't believe that anybody is looking at or trying to get high and abuse these drugs or at risk. Well, I don't believe that anybody's trying to do this on purpose, use higher and higher amounts. The fact is that opioids do have a tolerance, and you can increase the dose without having those significant effects. However, when you increase the doses, you get more and more of the adverse effects, such as respiratory depression as well as slowing of the gut leads to constipation and a number of problems. So with CBD on board, in not having any need for the THC, it has the same capability of THC, getting people away from any addictive type of substance. And that applies to benzodiazepines. I've been particularly surprised, and that may be because it's working through those opioid receptors and modulating them so that they are not as sensitive or more sensitive to even our endogenous opioids that we circulate, and the body has a better response to those chemicals that are there. So there's also the part with regard to opioids of reducing the withdrawal that's associated with it, and the cravings that might be that are going to be there as well. So people can breeze through getting away from these particular medications without any significant problem. Well, great talking to you all, and I'm delighted to be able to share this information with you. It helps for me to understand more about the molecule and explore the literature on a regular basis, so I can learn more, so I can tell you more about what's happening in this area and in this field. Thanks for watching.